Talking Nachos is dedicated to helping dentists do three things. One, increase success. Two, decrease stress. And three, reduce the number of times you feel like crying inside. Because when you're a dentist, you have to keep all of your crying on the inside part of your body. I am so thrilled to be here with one of our supporters and sponsors. Could you introduce yourself to our audience? Just share with us who you are and what you do to help both dentists and patients.
All right. Thank you, Dr. Goodman, for having me on your
My
podcast. I
pleasure.
really appreciate it, and I'm a big Dental Nachos fan. Learned
Thanks.
a lot from this group. But my name is Dr. Colleen Mohn. I am a general dentist located in Midland, Texas, which is West Texas, and I graduated in 2016 from Midwestern University in Glendale, Arizona. And I am currently partnered with MB2 Dental. I own two practices with them, and I have been partnered with them now for about 9 years. So been with them my whole dental career. And so I have a lot to share about my journey from being an associate into ownership with a dental partnership organization.
I love that. And people can text MB2 to 215-543-6454 to find out about what you guys do. I was just at the Chicago meeting and saw the MB2 people there. I'm having Dr. Paul Etchison, come speak at our boost camp. We have a great relationship with MB2 for both of what I call my business children, our Dentist Job Connect program, which is also a Nacho sponsor, and Dental Nachos. And you're here supporting Dental Nachos to share your story. What I'd like you to ask next, Colleen, because I'm excited for this, is I actually want to start now and move back, right? I want to start in 2024 and move back. So just tell us about your life today. You are, I would call it, you are a Nacho ordinary practice owner. The way you own a practice looks different than the way dentists did 40 years ago. So just to explain to our audience, as an amazing dentist, awesome mom, business owner, what this looks like to you.
Yeah, so I have a fee-for-service cosmetic practice in Midland, Texas. It's kind of a more underserved area because this area is very oil business driven. And I have a 15-month-old little girl,
Nice.
and yes, she's walking, talking, creating havoc in the most
Yeah.
beautiful way. Her name is Summer. And then I'm married to my husband, Chris. He works in the oil business. He's from Canada. And we actually met here in Midland when I moved here after graduating dental school. So now I have this, beautiful family I've always dreamed of. I have my dream practice. I have an associate that works with me at my practice. And business is great, loving dentistry, waking up every day, excited to go to work. And it's a beautiful thing. And now looking back, I really had to make a big leap of faith in order to come to this position. I basically moved to this area after graduating dental school at Midwestern University in Arizona because I wanted to be in a rural setting where I was needed and where I could really gain a
Now
lot of
tell
dental.
us, Colleen, I'm going to interject. I tell my wife I just interject with brilliant ideas. I don't interrupt. It's 2016. You're in Phoenix, Arizona. You're graduating from dental school, and you say, hey, I'm going to move somewhere where I have no friends, no family, no fiance, no Fs, right? You got no
Mhm.
Fs, right? Uh,
Yeah, no
tell,
F's, no
yeah,
F's to give.
you're F-less. You're F-less,
F-less.
and you moved to Midland, Texas. I love that you did this. I admire it. I want to share. I would never do it personally, but I admire that you did it. And I love sharing
Big
stories.
leap of faith.
What was your motivating factor? And maybe now we're into the M's, mentorship, money. So tell
Mhm.
us about your motivating factors of going from a area that's so saturated with human beings and dentists to an area
Yes.
that is rural. Talk to us about that.
Yes, so the M's definitely played a big role. For me, out of dental school, I was like, I need to come to a place where I know I'm going to be doing a lot of procedures. My goal was I wanted to be an excellent general dentist. I wanted to be the dentist that patients could come to, and I can basically do anything that they required of me within my skill set. So mentorship was a huge part. The doctor whose practice I joined, he had a few practices with MB2 at the time. And I didn't really know anything about MB2 because his practice was so unique to his way of practicing. I didn't even know that there was, a support structure. That just speaks to the autonomy that MB2 provides. It's not that like corporate environment.
Yeah.
It's based on the actual partner and how they want to practice. So he mentored me not only in the business aspect of, hey, how do you handle patient interactions? How do you navigate insurance? But also how to become really efficient in the dentistry that I was doing, how to treatment plan, effectively, how to get good case acceptance, and then how to follow through with those results. So mentorship was the number one thing, in addition to me wanting to get clinical experience.
I like
And
some
then
mentorship, more procedures, and now
more
tell us about the
procedures,
money
and
part.
then the third M is the money part. So in Phoenix, Arizona, I essentially would have been making half of what I would be making in a rural environment. When coming out of dental school, the loans at this point, were pretty high, not as high as they are today, but high enough for me to say I'm willing to sacrifice some comfort going to a new place just so that I can start to pay off my loans and start to really get some money in the bank. I remember when I moved out to Midland, my dad packed his U-Haul up with me, and we drove from Phoenix to West Texas. My dad drops me off, kudos to him, but he had to give me money to fill up my car because I had no money. And I was just basically about as broke of a dental student you can get. Going from that to making $250,000 my first
That's
year,
awesome.
just doing bread and butter dentistry, for me, that was a huge leap. And then the opportunity with MB2 to partner and buy a practice with them a few years later down the
So tell
road.
me this. I just want to, because us dentist people, we love details, right? So I love this. It's 2016. Love the story about your dad. So you're there as an associate dentist. More procedures lead to more money. More
Mhm.
mentorship leads to more procedures. All these M's are intertwined. So it's 2016. You're making $250,000 a year. You're learning from your mentor. You feel
Mhm.
good about your career. I do want to bring in when you met your F fiance, not yet, but tell us about your dental
Yes.
growth. When was the time you said, okay, I want to move from associate to owner with MB2? Talk to us about that.
Yeah, so I think for myself, if I'm starting to feel a little too comfortable, I know that it's time to grow. And I
Yeah.
think when I was an associate after 2 years, that's when I realized, hey, I feel good about this. I've learned everything, I've gained all the knowledge that I like. I'm ready to really just step it up and be an owner. I originally had that as a 5 year plan. I thought, I'll be an associate for 5 years. And if I learn enough at that point, make the leap into ownership. But because I had chosen to go to a undersaturated area and had as much potential as I did that first few years, then I said, let's go ahead. I'm ready. And I told MB2, I'm ready to become an owner of my own practice. I've learned everything I need to, and I want a little bit more stress. Let's do it, bring it on. And then that's when they helped me find opportunities. It would have either been a de novo practice, so a startup, or buying out a retiring doctor. And once I met with that retiring doctor that they knew he'd been looking for an associate to buy into his practice for quite some time because, again, it's very underserved. And I met him, and his practice was beautiful. It had just been built a few years previously. He had a long tenured team of patients that had gone to him his entire 40-year career. And he was doing fee for service, cosmetic dentistry, bread and butter dentistry, literally checked off every box of what I envisioned me doing in my owner career. So once I met him, MB2, and I really wanted MB2 support on the business side so I could focus a little bit more on the dentistry, we went in and did that integration, and we've grown the practice ever since then, retained the team. It's just been a dream.
I love that. Now tell us a few things. If we talk about some common either misperceptions or possible objections to working with the DPO or DSO, do they call you every day and say, "Hey, Colleen, you better do more scaling and root planing, or you're in trouble," or
No,
"Hey, Colleen, you better
no.
do more crowns, you're in trouble"? But that comes from times that may have happened in a corporate world, right? It doesn't happen to you.
Yes.
So kind of just explain, to someone saying, "Hey, I'm an owner of this practice with MB2. How does
Mm-hmm.
that impact things? Like, they support me with business, but I get to make my clinical decisions. I got to report my numbers." I'm totally actually curious on this, kind of deepen our
Yeah.
understanding.
That's a great question. I do think that there are a lot of misconceptions, but just like anything, you may have private practitioners that try to take advantage of things. You could have had that in the past with certain
Right.
corporations. But I think it all depends on the model and the culture. With MB2, and I mentioned previously, when I was an associate at that practice, I didn't even know MB2 was involved. That's how hands off they were. They were just there to support the owner of the practice, but he was making all of the decisions for his practice. So I think that is huge. I would not have joined MB2 if there was any question of autonomy, or that I couldn't make my own decisions. If that was the case, I would have just gone out on my own. But I saw the value add that MB2 had without micromanaging and without telling me how to practice.
Gotcha.
So all of that was huge, the number one thing. What they do is they just support on the back end of the business. So let's say I want to bring in more patients. They have a marketing department that will look at strategies in my area and say, hey, if we update your website, or if we do mailers in combination with, radio ad, or, certain community outreach programs, we've seen this be effective in areas like yours, let's implement it. I give them the yes or no at that point. So MB2, they will be there for support, but they're not restrictive, and they're not going to tell me how I should run my practice. That's the partnership. And then the other key is all of our partners own equity in their practice. I think that if you have owners who don't actually own a percentage stake in their own practice, then they don't have the ability to make those decisions. So that gives me the power to say, I know what's best for my practice, for my patients, for my staff. What can you do to help support me in that? And that's where they come in.
Your goals wind up being aligned with that. I see that now.
It's
I want to take an
alignment.
F break. When did you meet well, I know you're married now. That's okay. We see you. Tell us about when you met your fiance. I know it's more than your fiance now, but you're in Texas. You're a dentist. You make a few friends along the way, I'm assuming.
I did. I made some friends who worked at oil companies who were like
Yeah.
engineers. They're about the same age, and they come in, to work a few years and then, work for Chevron and some big corporations. So I did make friends. Since there's not a lot to do here, you really do meet people easily and
then
socialize.
when did you meet your husband?
So I met my husband, let's see, August 2016, I moved here in the beginning. September, I met my husband. At the time, it was an app called Bumble. It was a female empowerment app, very romantic, modern day love story. But, it was nice. I was able to do my research
Was
on
he
him
from
before
the
I
area?
met up with him.
I like that. You
No,
researched
so
your job and your husband. Good job, right?
exactly, yeah.
Was he from
No,
the
so
area?
he's from Calgary in Canada, Calgary, Alberta. He worked in the oil field up there, and then a few years before I met him, he had moved down to Midland, Texas for his job as well. So he was in a similar situation as me. He moved away from his family because of the opportunity. Very hardworking man, and Canadians are very nice people, so that also was
Yes,
huge.
they
The
are. And I
stereotype
feel like
there.
you guys should call yourself, people call it transplants, but we're dentists. You were both Midland implants, right? You were taken from somewhere
Midland
else,
implants. Yeah,
implanted in the Midland. So
yeah.
now you have your husband. Now I love this story. We talk about it, Dentist Job Connect. Hiring an associate dentist unlocks more freedom, more free time, fuels growth, and best of all, fewer hygiene checks. So tell us about now you were an associate owner. When did you
Yeah.
incorporate an associate? What have been some of the benefits of having an associate dentist in your practice?
That has been outstanding, especially being a mom now, with my 15-month-old little girl. Fast forward, I got married to my husband in 2020, and now we have a little girl. And so having time, like you mentioned, is so important to be able to step away from the office, but to know that the office is still going to be productive and still running. So let's cut to 2019. Got my practice. The retiring doctor, he stayed on to that practice for 2 years. During that time, it was initially a 6-op practice, just for himself. So it was a one doctor practice. We had 2 rooms that we were plumbed. We went ahead and built those out. MB2 helped me to equip those so that I could come in and integrate myself and start practicing. So now we have 8 operatories. He stays on, and I get mentorship from him as well, just so I can come in, make it a smooth transition, get to know the patients and staff, because this is a legacy practice. I wanted to make sure they knew that I was going to honor his legacy and that they would be in good hands with me. So when he was getting ready to retire towards the 2021, I had actually reached out to a doctor who I was an associate with. She's from Houston, and she had moved to Midland as well for her job with her husband, who worked in the oil field. And she was on maternity leave at the time. And so they had already, found some more associates for that practice. But she and I had worked together previously, and I called her up and said, "Hey, if you're ready to come
Yeah.
back, I would love to have you at my practice." And it was a bit of a risk because having an all-female dental practice in this area was very unheard of. And so there was a little bit of that, uncertainty of how
I
that would
like
go
it.
with the community. But bringing her on has just expanded not only our potential within the practice productively,
Awesome.
just with adding that, but also to ability for her to do hygiene checks. Well, let's say I'm doing an oral sedation case and I can't step away. She gets in there, gets to know my patients, and she and I are both aligned in our care.
I
And so
love that.
it's been
What year did
excellent.
she graduate from dental school?
2018.
Tell me, kind of, some people will be, I hope they're curious instead of critical, but who knows? But let's say if they hear that there's two dentists, a 2016 grad and a 2018 grad, running a thriving general practice, collecting $3.5 million a year, that's a significant amount of production. Kind of walk us through how you can be so productive as two general dentists. Is it the additional procedures, the volume, the new patients, a combination? Just tell us a little more about that.
Yeah, so I do think it's a combination of everything. However, she and I both work so well together in that there are procedures that I love to do that she may not be, as excited about. For example, I love extractions. I love doing endo. I also do, liner treatment in addition with some clear brackets, just some cosmetic short term ortho. And she loves to do crowns. She loves to do full veneer cases, cosmetics. So the nice thing about having an associate and to increase your production is how much can you keep in house,
Yeah.
and how do you both work together? So there are things that I can do to serve my patients and things that she can do to serve my patients based on her skill sets. And so that's what's really that combination and building that culture too. She's an excellent person. She and I both have the same culture within our staff, which is kindness, support, trust. Just it's a work family, spend so much time together. So just making sure that our staff supported, that all builds the practice up to what it is. And then the more patients you see, and I get a lot of patients who are anxious, who've had bad dental experiences, and I do oral sedation with them. A lot of word of mouth comes in there. It's a smaller community, so if you build up that reputation, then the people will come.
That's awesome. You two should be proud of yourself. That says we should say to our children, instead of "I'm so proud of you," be proud of yourself. I saw a video on that I really liked. So you two
Oh,
should both be proud of yourself that you're helping this community, that you're doing more
mhm.
procedures. I think it's important to highlight as someone who has the totally opposite type of dental practice in a very saturated area that there's specialists sometimes down the street that I can use. And
Mhm.
when you're in a rural location, all the stories that I've collected over the past Nacho time is doing more procedures is not only doable, but often necessary, right? So your patients can be able to
Necessary.
get these things done, right?
Yeah.
It's not as easy as, when I was a new dentist, if I said, "Oh, you might have to go to an endodontist," the patients had been there so many times. "Oh, the referral pads are in drawer number 3 over there, new associate," right? It's just a very different type of dental business model. And I think
Yeah.
it's so cool that you can take your dental school experience, have mentorship, train. And when do you guys be ready for the next associate?
Yeah, so I mean that's always in the works. We have 4 hygienists now, so we're growing our hygiene program, and at some point we probably will start to max out our space.
Yeah.
There's going to be space next door, I'm sure, if we do end up expanding. But I think it's great to be able to have this amount of growth in the trajectory and to know that what we're providing the community is needed and we're making an impact. So I think that the growth just naturally will come when it's time. She's about to have her a second child here in August. So at that point, we'll probably look and see what we can do to
Yeah,
bring the other one
you have
on.
a good marketing thing with like moms mentoring in Midland or something like that.
Yeah,
You know? Moms mentoring in Midland. Well,
yeah, no, for sure. We're part of a Moms of Midland group, and
yeah.
so yeah,
You
we give a lot of advice to moms.
you have shared so much. I want to
Oh,
share. Thank you
thank
for
you.
supporting our community, both Dennis
I
Jopnik
love
and
it.
Nachos as a sponsor. People can text MB2 to 215-543-6454. Is there anything else you'd like to share with maybe a dental student watching, a new dentist, anything
Mhm.
about your experience, your life, the F's, the M's before we wrap up?
Yeah. I think I just want, younger dentists to know, or newer grads to know, that you don't have to go out, and buy a private practice right away if you're not able to, or you don't have to go out and work for corporate as an associate. You could potentially, work with an organization like MB2, which is that hybrid partnership model, and be able to practice dentistry, be able to have some financial support so that you can own a practice without taking on a lot of the other, risks that go along with that, and be able to have mentorship, not only business side, but clinically. I think that that is a great avenue to look at, and I'd be happy to be a resource for anyone who's interested.
Awesome, Colleen. Well, stick around with me for a minute, but thank you so much for
Okay,
sharing with us.
thank
We truly
you.
appreciate it. If anybody wants to connect with us for any reason about talking nachos or anything we do, please reach out to us at dentalnachos.com. Thanks so much,
Thank
Colleen.
you. Thanks, Dr. Goodman.